Well, good morning, and pleasure to be here to tell you a little bit about what I've been doing lately. So I'm sure everybody in this room knows that serotonin release in the brain is involved in the regulation of mood. And this is the basis for the mainstream therapy that utilizes the 5-HT selective reuptake blockers. And I'm showing here on the left-hand side of the screen the main serotonergic nuclei of the brain. And I'd like to just concentrate on the one in blue, which is the dorsal raphe, that projects dorsally to the higher centers, and also the one in sort of, what is that, lilac? The raphe obscurus, which projects ventrally, sometimes referred to as the ventral raphe. Now, the dorsal raphe seems to work a bit like a sprinkler system, irrigating the brain with serotonin. And it does this because the cells fire in a very slow, regular, pacemaker-type fashion, about 1 or 2 spikes per second, except during arousal. And over on the right-hand side, this is really just a cartoon of dorsal raphe firing against time. And the point that I'd like to make is that the average firing rate of dorsal raphe neurons appears to vary according to one's state of mood. It's lower in depression, so lower than the dashed line, still lower when 5-HT reuptake blockers are on board because it potentiates serotonin and that inhibits the serotonergic neuron activity. But after about 4 to 6 weeks, there's a desensitization of the serotonergic receptors on the cells, and the activity seems to come back to normal, but now there's reuptake blockade so that it potentiates the effect of serotonin throughout the brain. So our main goal was to understand the regulation of firing of the pacemaker activity of dorsal raphe neurons under normal conditions and in disease. So for instance, at those 4 levels of activity. Okay, so we have recorded from cells in the brain slice, but also from acutely isolated adult serotonergic neurons from both rat and mouse. And you can see near the top right, there's a particularly nice acutely isolated adult serotonergic neuron. And these cells respond to serotonin, and they have all their ion currents. The nice thing about this preparation is you can patch clamp them in a dish, and you can get quite good voltage control, actually quite excellent voltage control of currents like sodium currents that are subject to space clamp problems. Okay, so with Henry Tuckwell in Australia, we modeled the activity of dorsal raphe neurons using 11 different conductances. And you can see a printout of the activity of a dorsal raphe neuron as a computer model. And we were particularly struck by the fact that there appears to be a small pacemaker current that's required for regular firing in the interspike interval, and that's labeled P. We modeled this with a small inward leak conductance at the time. But subsequently, Lauren Milescu, who's now at the University of Maryland, well, actually, I should say that at very positive potentials, of course, we all know that sodium currents inactivate and then recover very rapidly from inactivation. However, about 20% of the sodium current recovers quite slowly over a period of 1 to 2 seconds. And this has been termed long-term inactivation, initially by Goldberg in 2007. And Lauren Milescu recorded from ventral raphe pacemaker cells in the slice preparation and showed that, let me see if I can point it out, he recorded quite nicely the bi-exponential recovery from inactivation of the sodium current here, taking about two seconds to recover. And he postulated and went on to essentially prove that the recovery from this long-term inactivation could be responsible for this small pacemaker current that regulates the interspike interval. If you stimulate rapidly, you can see that the long-term inactivation is cumulative and increases. Now, I was able to reproduce this finding in acutely isolated dorsal raphe neurons, and so this, I'm showing here the recovery from inactivation of sodium current, shown in blue, and you can see that there's about 20% that hasn't recovered at about a second, and this lasts often for about 2 seconds. So we could reproduce long-term inactivation in acutely isolated neurons. So because this symposium is talking quite a bit about schizophrenia, I think it's fascinating to note that LTI is significantly reduced in human-induced pluripotent stem cells developed into neurons. And so this was recently published in PNAS by a group from Johns Hopkins, Brady Mayer, I believe. Okay, so my final slide shows that the function of long-term inactivation is to help the neuron to maintain a low spiking frequency against sustained depolarizations. Now, we used quite an elaborate and interesting technique called dynamic clamp that isn't used very often. Now, in this situation, in the slice preparation, this was done with ventral raphe neurons. You add tetrodotoxin, which blocks the sodium current, and then you replace it by injecting a sodium current model, which is triggered by the membrane potential. So the more depolarization occurs, the more of the sodium current model is injected into the cell. And you can replace the action potentials that way. And you can add a model that has LTI or lacks it. So all the other currents actually just turn on as they normally would at any given voltage. So they're not affected. So in the top trace, at the very top is shown action potentials, and just below it is the sodium current that's been injected to produce them. Now there's a steady biased depolarizing current that's added, and it's stepped up from 0 picoamps all the way up to 40 picoamps. The areas in black represent the period where there is no LTI in the sodium current model, and the period in red is with the addition of LTI. And in the panel B, the order of application is simply reversed. In C, in the bottom left, we've actually plotted the spike frequency against time. And you can see that in the periods where there is no LTI, the firing rate does decline. And that's because there are endogenous conductances like calcium-activated potassium currents that cause accommodation of the spike firing. However, when you add LTI to the sodium current model, you see a much greater reduction in the firing rate.
1 minute.
And in my final panel, D, 2 different models of LTI were injected into the cell under dynamic clamp, and the activity was measured with different bias currents of stimulation. So you can see that the frequency of firing versus current injection is much flatter in the presence of long-term inactivation within the sodium current model than without it. So in conclusion, long-term inactivation is implicated in regulating the pacemaker function and the burst firing in raphe neurons. So the cells would fire a lot faster without LTI. In future work, we could perturb the activity of dorsal raphe neurons using pharmacological methods to treat depression. The LTI component could be compared with the control group of neurons before and after the activity of the neuron has recovered from desensitization of the 5-HT1A receptors. Thanks for your attention.